Stroke is a medical emergency that occurs when the brain is deprived of its blood supply, leading to rapid cell death. There are two primary types of stroke, ischemic and hemorrhagic. Although both disrupt brain function, the mechanisms behind them are fundamentally different. Ischemic stroke is caused by a blockage that obstructs blood flow to the brain. This blockage usually forms from a blood clot or plaque buildup in the arteries. On the other hand, hemorrhagic stroke results from a blood vessel rupturing, causing bleeding inside or around the brain. While ischemic strokes are far more common, hemorrhagic strokes tend to be more severe due to the sudden pressure created by internal bleeding. Understanding the distinctions between these two stroke types is essential for recognizing symptoms, seeking immediate medical help, and choosing appropriate treatment. Awareness helps reduce mortality and improves the chances of recovery. An ischemic stroke occurs when a blood vessel supplying the brain becomes blocked, cutting off oxygen and nutrients. The blockage is often caused by a blood clot forming within the artery, known as thrombosis, or by a clot traveling from another part of the body, known as an embolism. Plaque buildup from high cholesterol can also narrow arteries and trigger clots. When blood flow stops, the affected brain cells begin to die quickly, leading to speech problems, paralysis, or cognitive deficits depending on the blocked area. Because ischemic strokes progress rapidly, quick recognition and treatment are vital. Most modern treatments focus on dissolving or removing the clot to restore circulation. Ischemic stroke is the most common type, accounting for approximately 85% of all stroke cases worldwide, making it a major global health concern. Ischemic strokes are primarily caused by conditions that promote blood clot formation or restrict blood flow. High blood pressure, high cholesterol, diabetes, and smoking all damage the blood vessel walls, making clots more likely to form. Atrial fibrillation, a heart rhythm disorder, causes blood to pool in the heart and form clots that can travel to the brain. Carotid artery disease, where plaque narrows the arteries in the neck, is another major contributor. Obesity, sedentary lifestyle, and poor diet also increase risk. In some cases, blood disorders that cause abnormal clotting can trigger ischemic stroke. Understanding these causes emphasizes the importance of managing cardiovascular health through regular medical checkups, medication, and lifestyle changes. A hemorrhagic stroke occurs when a blood vessel inside the brain bursts, causing bleeding that quickly damages surrounding tissue. This type of stroke is less common but often more severe because the accumulating blood increases pressure inside the skull. The rupture typically happens due to long-term high blood pressure, which weakens vessel walls, or from aneurysms, balloon-like bulges that can burst suddenly. Hemorrhagic strokes can occur within the brain tissue, intracerebral hemorrhage, or in the space surrounding the brain, subarachnoid hemorrhage. Symptoms often appear abruptly and severely, including intense headache, vomiting, loss of consciousness, and neurological deficits. Rapid medical intervention is critical to control bleeding and prevent worsening brain injury. Hemorrhagic strokes stem from factors that weaken or damage blood vessel walls. Chronic high blood pressure is the most common cause, as it strains vessels until they can no longer withstand the pressure. Aneurysms and arteriovenous malformations, AVMs, also increase risk by creating abnormal vessel structures. Blood-thinning medications, such as anticoagulants, may cause excessive bleeding in vulnerable individuals. Trauma to the head, uncontrolled alcohol consumption, and certain blood disorders further elevate risk. Aging also contributes by making blood vessels more fragile. Identifying and managing these risk factors is key to preventing hemorrhagic stroke. Although both types of stroke impair brain function, their mechanisms differ dramatically. Ischemic stroke results from blocked blood flow, whereas hemorrhagic stroke results from bleeding. Symptoms may appear similar because both reduce oxygen delivery to the brain. However, hemorrhagic strokes often present with more severe symptoms, such as sudden intense headache and rapid loss of consciousness. Treatment also differs significantly. Ischemic strokes require clot dissolving or clot removal therapy, while hemorrhagic strokes require bleeding control and sometimes surgery. The risk factors overlap but differ in emphasis. Blood clots and cholesterol play bigger roles in ischemic stroke, while high blood pressure and aneurysms are stronger contributors to hemorrhagic stroke. Understanding these differences helps guide rapid and appropriate medical response. Despite their differences, ischemic and hemorrhagic strokes share many early warning signs because both interrupt blood flow to the brain. These include facial drooping, arm weakness, numbness on one side, speech difficulty, confusion, vision problems, dizziness, and trouble walking. The fast rule face, arm speech, sign is an effective way to recognize stroke symptoms for both types. In some hemorrhagic strokes, additional symptoms such as severe headache, nausea, or vomiting may appear due to increased pressure inside the skull. Regardless of symptom type, quick recognition is essential. Both stroke types require immediate emergency care, and delaying treatment can lead to permanent disability or death. Diagnosing the type of stroke is crucial because treatment end depends on whether the stroke is ischemic or hemorrhagic. Doctors typically use CT scans or MRI to determine whether a clot or bleeding is present. A CT scan can quickly identify bleeding, while an MRI provides detailed images of brain tissue. Additional tests such as angiography, blood tests, and heart monitoring help pinpoint the cause. In ischemic strokes, imaging may reveal a blocked artery or reduced blood flow. In hemorrhagic strokes, imaging shows areas of bleeding and swelling. Rapid diagnosis ensures that treatment is targeted and effective. For example, clot-dissolving medication is safe for ischemic stroke, but extremely dangerous for hemorrhagic stroke, making accurate diagnosis essential. Treatment for ischemic and hemorrhagic strokes varies greatly due to their underlying mechanisms. Ischemic strokes are primarily treated with clot-dissolving medications such as TPA, which work best within 3-5 hours of symptom onset. Mechanical thrombectomy, a procedure to remove the clot, may also be used in certain cases. In contrast, hemorrhagic stroke treatment focuses on stopping the bleeding and relieving pressure inside the skull. This may involve controlling blood pressure, reversing blood-thinning medications, or performing surgery to repair ruptured vessels or remove pooled blood. Intensive care monitoring is essential for both stroke types to prevent complications. Early intervention offers the best chance of recovery. Understanding the difference between ischemic and hemorrhagic stroke is vital for early recognition and appropriate treatment. Although they share common warning signs, their causes, severity, and medical interventions are very different. Ischemic stroke caused by blockages is far more common, while hemorrhagic stroke caused by bleeding is often more severe. Both require immediate emergency care, and delays can result in severe brain damage or death. Educating yourself and others about these two stroke types, learning the FAST rule, and recognizing symptoms early can save lives. Stroke awareness is not just knowledge, it is a life-saving tool that protects individuals, families, and communities.